Thoracoscopy for lung cancer. Introduction. The heart and major blood vessels are located in the middle and to the left of the chest in an area called the mediastinum. Select true or false. Correct. It is always possible to determine the cause of cancer in a patient. Select true or false. Correct. It may be impossible to specify the causes of cancer in an individual patient, but we do know what can cause cancer in some people. Are heart attacks and other anesthesia-related complications common during and after this surgery? Select yes or no. Correct. Anesthesia is safe, but the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as heart attacks and lung problems. Blood clots in the legs after an operation are harmless. Select true or false. Correct. Blood clots in the legs are dangerous, even though they are unlikely to happen. The symptoms may include swelling of the leg, shortness of breath, and chest pain. In rare cases, a blood clot can go to the lungs and cause death without giving any other symptom. Are infections very common after lung surgery? Select yes or no. Correct. Infections are rare. Though rare, infections, bleeding, and scarring may occur. In cases of severe deep infection, another operation may be necessary. It is impossible to injure the heart or great vessels during this operation. Select true or false. Correct. Injuring the heart, great vessels, trachea, or feeding tube is possible, but it is rare. Thank you for using Explain.